Recording. Okay, Bill,
Yes.
I'm happy to let you know you're not a loser.
No,
I'm
We are.
sorry, Bill. I'm the loser.
that's
No, you're not. You
okay.
know what, Christina, here's the deal. We're learning how to do this, right? It just means that Bill gets to do this again in the spring because somebody's not going to be able to do one of these, and Bill's just going to step in. And so, ladies, you are his test audience. So if this beautiful, compassionate plastic surgeon doesn't cut the mustard tonight, just know that we're doing the best we have.
Yes. What's that old saying? You get what you pay for.
Yeah.
Um,
Wait, is Christine on a beach somewhere?
Oh, she would like to. She was this
with her
weekend when
hat
she got
on.
baptized.
What is that, a fake background?
Yes.
Oh, I love it. I want that. Uh,
All right, Billy boy. Everybody else is
Okay.
going to mute, including me. I love you. Thank you for doing this, and we will we will redo. We'll do it again because you're gonna knock the ball out of the park.
All good. All good. All right. So we're going to run through some survivorship information. I'm just going to go through some slides, and then we're going to open it up for questions. I'm going to run through a few resources before that. But let's dive in, and we'll get through the slides so we can have more intimate conversation. So I wanted to start by talking about survivorship guidelines themselves. So a lot of these
Recording in
changed in
progress.
2024. Oops. We good?
Yeah.
Okay. So a lot of these changed in 2024 with a number of different overseeing bodies. And so wanted to run through a few of those because they were big changes. The first of which was the National Accreditation Body for Breast Cancer Institutes. And what they changed was that the point of diagnosis is now when survivorship and surveillance is to begin. This was a big change. It used to be that we never talked about any sort of survivorship programs until all treatment was done, healed from surgery, all drains out, all that sort of stuff. And so this was a big change in the concept of as soon as someone is diagnosed, you really need to start looking at survivorship, which is a good way to look at it. But it was a big change in the way that we were looking specifically at breast cancer. The American Society of Clinical Oncologists, so looking at all cancers, also had an update in 2024. And you can see what they include in their survivorship: nutrition, exercise, fertility, sex and intimacy, mitigating side effects. But the big change was including mental wellness. Talking about stress management, release of fear, and building of resistance. And this, again, is something that I think was a long time coming, but was an important change and hopefully will allow us to start addressing some of these things moving forward. Why is this important? Well, we've got data that shows us that 80% of women who go through a breast cancer diagnosis will exhibit PTSD symptoms. And these can be running the spectrum. It can be well after the treatment. It can include flashbacks. I mean, we all have that, you walk into the cancer center and that there's that smell or there's something that you're like, oh, I remember when I had to go through that. But some of these are truly deep-seated issues that we should be addressing in survivorship. And I don't think we're doing a good enough job. So the fact that we're now including these in our overseeing bodies and what it is that needs to be addressed, I think is a good thing. We're still falling short, in my opinion, but it's a good thing that we're at least talking about it. We also need to talk about the fact that some of these medications that we're putting people on can contribute to mental health issues and specifically depression. So here's a list. Unfortunately, we're all familiar with a lot of these, but we need to keep in mind that these are things that can contribute to it. So just going through the diagnosis and then we're throwing these things on top of it can really affect someone's mental well-being. And we need to be talking about it and we need to be addressing it as we move forward. Here's a study looking at breast cancer patients and people with depression. And what it said was that it really called for widespread screening for and treatment of depression amongst breast cancer survivors. So, first, we have to ask about it. We need to be talking about it. And then we have to make sure that we've got the right people in place to be addressing it. And I can tell you, unfortunately, there are a lot of cancer centers that this isn't the case. They don't have the people that are asking these questions and then following up with some of the treatments that are needed. When we look at people, two different studies here, but when we're looking at people who have depression and breast cancer, 22% of them have moderate to severe depression. So that's not something that you're just going to work through on your own. This really needs to be addressed by a professional. And in cancer patients that we put on antidepressants, we're seeing the same effect as placebos. So, just by saying, oh, you're depressed, we're going to throw you on medication. This literature is showing us it's really not going to do anything better than putting them on sugar pills. So we really need to make sure that we've got the right people involved to be working with them in order to get through this. So what can we do about it other than working with a professional? Well, here's a study that shows that physical activity is highly beneficial for improving symptoms of depression, anxiety, and distress. Well, this is something that we certainly can look at with all of our cancer patients, and it's something that has really given birth to exercise oncology. So, had we talked about this in the 90s, there were very few studies that talked about exercise oncology and what that meant. But you can see now we're getting over 2,000 new studies every year looking at the benefits of exercise specifically with cancer survivors. What about the body itself? Well, here's a great study looking at newly diagnosed breast cancer patients, and all they had them do was get on a stationary bicycle for 10 minutes. They pulled blood before they got on the bike, they pulled blood after they got on the bike, and what they saw was an increase in the immune cells. So this is showing that just 10 minutes of sitting on a stationary bike is going to increase the effectiveness of our own immunity. So this is going to help us get through that surgery we just went through. It's going to help us with the side effects of the treatments that we're doing. It's going to help us fight off that common cold that everybody's worried about getting. Now, this was intensity related and time and dose related. So obviously, 20 minutes on the bike was better than 10 minutes on the bike, but just 10 minutes, and we saw a difference in the immune cells that were circulating in these patients' bodies. Here's a study that looked at lots of different types of cancer. So it included breast and colon and prostate and ovarian and lung. And what they looked at was exercise programs and longevity. So it was a big study. So they had over 11,000 people. And some of this isn't a surprise, right? When we see that, oh, cardiovascular endurance went up 15% and muscular endurance and flexibility went up. But look at some of these other ones. Quality of life went up 58% for those that were exercising. Feeling more positive, 75%. Now, again, just throwing somebody on an SSRI is not going to get us that result. So this is showing us that the exercise is really helping with the mental health aspect as well as the immune aspect. Feelings of support. I can't explain that, but they had a 58% increase in the people that were exercising. So again, it's something that I think we need to be talking about. If you look across the world, other countries, it's included. So like in Australia, every single person that gets diagnosed with cancer gets an exercise program as part of their treatment plan. So certainly they're ahead of us when we start looking at that, but at least we're starting to talk about it and we're starting to see a lot of articles that are showing it. What about our metastatic patients? Well, it used to be that, oh, these are frail patients. You really shouldn't, be engaging in any of things. Well, again, here's, 5 European countries and Australia looked at moderate to high intensity exercise programs with patients with metastatic breast cancer. And across the board, they saw positive effect on cancer related fatigue and quality of life. So again, it's not the fact that, oh, they're metastatic, you shouldn't have them doing weight bearing, you shouldn't have them doing exercise. That's a fallacy. That's old thinking. So we got data that shows that it is beneficial for these patients to be involved in exercise programs. Here's a study that again was presented last summer at the European Society of Medical Oncologists. We all think about, oh, exercise means I got to drag myself to the gym. Well, this was a study where all they gave them was a connected watch and had them use a digital platform on their TV. So it was just videos, it was virtual coaching, and there was a 4-month intervention, and they saw a significant improvement in the quality of life. However, when left to their own, by 12 months, they'd reverted back to the same scores. So unless you're going to continue with the exercise, you're not going to see the benefits. So unfortunately, it's not the type of thing that we can just do for 3 months after treatment and then have the results for the rest of our life. It's something that we really need to be engaged with on an ongoing basis. But it doesn't have to be at the gym. All sorts of things can be done at home. Obesity. We know that 4 to 8% of all cancers can be directly attributed to obesity. We also know that obesity may increase the adverse effects from treatment. So again, it's kind of a double whammy. Not only are we more apt to get the cancer, but then we're more apt to have symptoms while we're going through the treatment. We know from a surgical perspective that the obesity increases the chance of having wound problems and healing issues. So what this statement is saying that structured exercise and diet should be a part of every cancer treatment plan. Certainly, it should be discussed. So you are what you eat. Let's try to make healthy choices. Well, good luck with that, right? I mean, it doesn't matter what social media you're looking at or you're pulling out the old Time magazines. Every week it seems to change, right? You drink coffee this week, don't drink it next week. Put butter in your coffee this week, avoid all dairy next week. So again, it is difficult in order to make the decision as to what's healthy. So let me try to boil it down as simple as it can be. We know the standard American diet is the best way to grow a cancer. It is absolutely the most unhealthy thing that we could possibly consume. And again, you can see from the diagram here, again, it messes up your microbiome, it increases your inflammation, it messes with your hormones, your insulin. And then on top of it, if we add that we're sedentary and that we're not exercising, that makes it even worse. Our estrogen goes up, inflammation goes up, stress levels go up. So again, starting from there, it's the worst we can do, right? So if we start there, all we can do is go up and get better. When you break it down, it's really just looking at what's inflammatory and what's anti-inflammatory. Anything that is pro-inflammatory is going to feed a cancer, right? This, unfortunately, is what you're going to find, as you're walking through Disney World, right? It's the pizzas, it's the hot dog, it's what I like to call the brown food, right? There's no color in it; it's all brown. I had to laugh the other day. I saw a commercial. I think it was for well, it was one of the fast food joints, and they were going to give you biscuits, they were going to give you fries, and they were going to give you fried chicken. And again, all brown. I said, at least throw a piece of parsley on that so it looks like there's something green. So if you just look at it from the standpoint of, is this going to cause inflammation in my body, or is it going to be anti-inflammatory? That's at least going to give us some guidance as to what makes sense to eat. When my patients ask me, specifics, I say, listen, keep it simple, right? Food should need to be refrigerated, right? You shouldn't be able to buy cheese or meat that can sit in your glove compartment for a year, right? That's been over processed. So I always tell people, I say, listen, if you can shop from the periphery of the store and realize that all of those things are going to need to be refrigerated and probably consumed in the next month unless they're frozen, then that's a start. The second thing that I tell them is, if it's advertised on TV, don't eat it unless it's avocados or pistachios.
Right.
Because anything else on TV, we really shouldn't be eating. Alcohol. This is never a fun one for me to talk about, especially, when I'm at a conference and there's an open bar in an hour. But the reality is, we used to think that for men, two alcoholic beverages per day were okay. For women, one alcohol beverage was okay per day, and that there may be some cardiac protective aspect of alcohol. We know that that's completely untrue. We know that 6% of all cancers can be directly attributed to alcohol. 4% of all cancer deaths in the United States can be contributed to alcohol. So the reality is this: when we go back to is it inflammatory or is it anti-inflammatory? It's pro-inflammatory. There is no benefit from drinking alcohol. So the reality is we just want to try to limit it, right? Instead of having 3 glasses of wine, we're going to stick to 2 glasses of wine. Instead of having, wine during the week, we're going to do it just on the weekends. So however much we can limit it, that's going to be healthier for us. We know people that have been, diagnosed with breast cancer have a higher rate of recurrence if they're consuming alcohol on a regular basis. So we just want to try to limit that. This is not 1 glass of wine.
Me too.
So when the doctor asks you, how much do you drink? And you say, I only do 1 glass of wine.
Yeah.
This is not it. So we want to keep that in mind. Here's the good news. So the American Cancer Society has said that by 2032, we're going to have 23 million cancer survivors in the United States. Why is that good news? That means that fewer people are dying from cancer. Our treatments are getting better. So the thing that I want to see is that's fantastic. Now let's try to work at preventing those cancers from occurring. I would like to see this number go down, not because people are dying from cancer, but people aren't getting cancer. So from a survivorship standpoint, that's also what we want to do. We want to make sure that we're doing everything that we can to prevent that cancer or any other cancer from occurring. Loneliness. This is something that, again, I just don't think we're spending enough time talking about. But I will say that, here's a fairly large study, 3,400 people, but they looked at the fact that after cancer treatments done, those that were considered lonely had a shorter longevity than those that didn't. So this is where I push people to get involved in groups, whether it's a support group, whether it's a face group, whether it's a church group or a synagogue group, or whatever it is that you can get involved in a group. And I'll have patients of mine that say, Bill, I never was into the support group thing. I said, that's fine. You're now in a position where you can help others. So you've been through this journey. Go help someone else get through the journey. That's going to actually have more of a positive impact on your mental health than not doing anything at all. This is what Jody's going to talk about next month, about putting these small groups together, right? So it's an intimate relationship. You're getting to know these people, and you're able to interact with them. Yes.
How do I know that name? She took my boobs off. Oh, right.
Somebody needs to mute.
It's all good. We'll keep going. So anyway, the reality is we don't want to see anybody being lonely after this. So get involved on some level, and by helping others, you're actually going to be improving your overall well-being. So in summary, we know that survivorship needs to start at the point of diagnosis. This is no longer something that is an afterthought. PTSD and depression are a part of a cancer diagnosis. We need to acknowledge this. We need to screen for this. And we need to be able to treat this. Exercise can reduce all-cause mortality in cancer patients. What does that mean? That means that your longevity increases if you're exercising. Now, again, we're talking about cancer. The reality is it's the same for everybody. If you're exercising, you're going to live longer. Your mental health is going to be better, and you're less likely to have a chronic disease. So again, we should be doing some sort of exercise. I will say there was just an article that came out that I found fascinating. I've always said just walk 15 minutes a day. Just get out there and walk 15 minutes a day. This article actually said it is better to do 4,000 steps 2 or 3 times a week than it is to do 2,000 steps every day. So there is something that on our body that has a threshold. So if you can get 4,000 steps in every day, fantastic. I know people have talked about the 10,000. That was a made up number, but this data has actually shown that there is a difference between 2,000 and 4,000, and we want to get to 4,000 at least 2 or 3 times a week. We know our cancer treatments increase anxiety and depression, some of the medications, and just obviously going through that diagnosis. So again, we need to be open. We need to be talking about this. We need to be screening for this, and we need to make sure that we have the treatments available. Dietary choices can increase or decrease cancer recurrence and longevity. So we just want to try to make the best decisions that we can about our diet. Doesn't mean that, you can't have grandma's cookies, but you just don't want to do it every night. And lonely survivors don't live as long. So we need to make every effort that we can to make sure that we're engaging in some sort of interactive group. And again, Jody's going to be talking about that next month, and hopefully we can get everybody involved in some sort of small group. Now, I want to talk a little bit about resources. So some of you may know I've been trying to help a startup get going, and they're working on survivorship, specifically dealing with cancer centers and physicians and nurse navigators in order to try to streamline things. But in doing all of that, they have put together a free cancer health hub. So any cancer survivor can get on this. It is totally free. It has information on mental health. It has free exercise videos. It has dietary information, recipes. It also has resources that, I'll be honest, to try to get in one place, I've never seen. So legal counseling. I don't know if you're aware of this, but in every state, there are lawyers, so I won't say anything bad about them today, that have agreed to donate their time to cancer patients. So whether you're concerned about financial issues, whether you're concerned about losing your job, whether it's something that you need help with legally, you can go to this. There's a link, and you just put in your zip code, and they will tell you who in your area is willing to help cancer patients pro bono. Cell phone access. We all rely on our cell phones, for appointments, for transportation, this sort of thing. There are people who unfortunately don't have access to cell phones. There is a link here that gets free cell phones for cancer patients. Transportation, same thing. Links for free transportation for cancer patients. Financial assistance. And then there's a marketplace of other things. So if someone wants to talk to a dietitian, if somebody is trying to get mental health assistance and can't seem to find it, there are links to help this, occur. Now, what I will say is, it's however much you want to get out of this. In other words, it will continue to ask you questions in order to try to tailor what it is. So you don't have to give it any of the information. You could just look at the stuff. But if you want to put in there that I have breast cancer, I'm worried about losing my job, and I need to lose 20 pounds. It's then going to, using AI, bring it together and say, give us your zip code. We'll tell you where the lawyers are that can help you. Let us know, what your insurance is, and we can tell you here are the virtual dietitians that are acceptable through your insurance. So again, you don't have to give this information, but the more that you give it, the more that the AI is going to tailor it for you. But it's completely free, and it's to any cancer patient. So I was pleased that they were willing to do this as they were trying to create a product to sell to the hospitals. Now, I do want to thank those of you that were able to make it out to sign the book signing for myself and Beth. It was great to see so many friendly faces, and we got to meet a lot of new people, which was fun. The books, both books, the links are on the HCF website, and then obviously mine is also on my website. What I would ask is if you've read either of the books, please go on and do a review. It always looks better when you've got a book and a few people have read it than if just your mom was the one that read it. So if anybody has read them, thank you. And if you wouldn't mind going on and doing a review, that would be fantastic. Now, I am going to open it up for questions, but I do want to mention, and Beth, you're going to have to jump in and tell me where we stand. But again, when we're talking about anxiety and depression, and dealing with survivorship after cancer. I know we've got the Mind Vibe study going on. I don't know what arms are still open, but that is something that is being done both in Arizona and in PA.
So in Arizona, we don't have a clinical trial, but we have Christina, who is actively providing Mind Vibe sessions for individuals. In Pennsylvania, we still have, I think we have 12 more participants. The arm for the most anxious people is wide open because we found out that our patients, and we love you all dearly, but you try to pretend that you're happier and going along better in life than you actually are, because nobody wants to come into their doctor and go, wow, 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 things are bad. And what we find out is when we do the deeper dive. So we're just accepting anybody at this point. We're doing the assessments, and then we're going to do a secondary stratification based on the PGWBI, which is the larger intake form that you have to fill out to say how you're doing and what you're doing. Anyway, those arms are open for people who've been in the trial, who've completed their 12 weeks. We've welcomed them back. If anybody wants to come in, we call it for a little reboot or a tune-up. Ashley is in the building just about every week. So we have her just accepting, like, you guys will come in and she'll stay and do it. And she's very happy to do so because so far the results have been extraordinary. So if anybody on the call wants to pipe up about how they felt from the Mind Vibe trial, in case there's someone on here that hasn't tried it, feel free to pipe in.
I can tell you from my,
There's Beth.
my experience.
Beth Jobson's going to pop in. I just saw her undo her thing.
Yeah.
And far be it for her to be quiet and reserved.
True. This is all true. So this Mind Vibe, what is it? I feel like it's not the vagus nerve thing, right?
It is.
It is.
Oh,
Yeah.
okay. Then I know what it is.
Because
no, I didn't do it yet.
You didn't do it? Oh, you know what?
I didn't
you were
do
one
it
of
yet.
the ones that had. You were one of the ones that had a conflict. Please call and get on the trial.
Okay, so
wait, Kimberly, will you tell her that she's just stupid if she doesn't do this?
Well,
I need to do it too. I don't know how to do it.
Oh no, stupid is good for me.
I told you, Beth.
Beth.
I told you, Beth, to do it. I told you. Yeah, it's great.
Yeah,
it's great. It helped me sleep. It was, for me,
Right.
it was more the anxiety, and I wasn't sleeping.
Right. I just for a second couldn't. I'm like, the
sleep issue has been such a great improvement for every participant. Yes. And initially, we weren't even going to study the sleep piece, but I added it in, and it's absolutely amazing. I'm thrilled with it. So, Christine and Beth, do you have Tony's number you can call? Or
I don't. I need to figure it out because I sleep about 2 hours a night. I figure it out. You
need that. That's Christina Raycow, can you? You can. It's Mind Vibe at hcf444.org is the email.
I'll go on the website. I'll find it.
Okay, it's right on the website. You can. Okay. If you go on the website, you can just click to it. But thank you.
Yeah.
Beth, I know your name was on the list. You didn't finish it. You had some conflict.
Yeah.
Your life is just too busy. But what did I tell you when I first saw you? Who's the most important person in the world?
I think it's me.
Yes. So make the time and do this because you'll love it. Okay.
Yes. I just got confused for I always blame the medicine. I
Mhm.
was like, wait,
Okay.
what's Mind Vibe? But I know what it is.
But
Oh,
sleep,
good.
I mean, just the sleep aspect, the sleep
Yeah.
hygiene is so important. We've looked, in fact, there was just an article that I read last week talking about clearing toxins during REM sleep. And so if you're not getting that REM sleep, you're just not clearing those toxins, which is important for us all.
I'm doing a keynote address at an oncologic naturopathic oncology conference in February, and the whole thing is on the great nerve, on the vagus nerve, and the data on vagus nerve, the benefits, they're endless, they're priceless, and this we're just basically scratching the surface when we talk about what we're doing with this trial. It's just the beginning, because I do believe we will be seeing changes in people's immune modulation. The data's there. We're at our infancy, and you guys are part of the pilot study that will be shared at the American Society of Breast Surgeons. I just need to get it closed and finished. So I think we need 12 more people. So volunteer. There's two. I see two hands. Anyway, recruit any of your breast cancer survivor friends.
Okay. Very good. Thank you.
All right.
Thank you.
Yes, ma'am.
All right. What other questions do you guys have for fabulous Dr. William Scarlett? Bill, I loved your slides. They're fabulous.
Well, I wanted to keep it short, but we needed to touch
Hmm.
on some of the stuff.
Yeah, I know.
Do you have any insight on like adding like magnesium or those things into your diet? Like I've changed my diet, but like now I'm thinking I hear all this stuff about add magnesium, it might help you, and I don't know.
I mean, from my standpoint, I had a friend of mine who may or may not have been involved in the mafia, but his
It's
family,
fine. My
uh,
family too,
his
it's fine.
yeah, his family ran all of the waste management in Manhattan. So you can
Okay.
imagine that was a big
Mm-hmm.
family.
Mm-hmm.
But I remember when GNCs kind of first hit the scene, and everybody was supplementing everything.
Yep.
And it cost them a fortune because they had to put strainers through all of Manhattan because most of these tablets are literally passing through without being broken down.
Mm.
And so I was just reading an article that said, the majority of the supplements that we take increase the cost of our urine, and that's about it.
Right.
That being said, getting a full panel is important. I mean, there
Mhm.
certainly are people that their potassium's low or their magnesium's low, and things can help with that. But if your kidneys are functioning correctly, even these sports drinks, everybody thinks, oh, I'm going to go out in hot sun. I need to be doing these sports drinks. Most of the time, your kidneys are so smart that you can eat anything that has salts in it, and it will balance everything
Mhm.
for you. So it's really not necessary to be spending all that money. That being said, I mean, magnesium, zinc, those are all things that can help you heal, but only if they're low. It's not the type
Mm.
of thing that, let's just take it, prophylactically. I would say, get your electrolytes checked. It's something that any family practice, doctor can do. They really should be doing at least once a year, if not twice a year. And certainly if you're following up with the oncologist, they should be doing it even more routinely. But yeah, have them check all of those and see, I mean, if somebody comes into me and says, I've been cramping at night, right? Well, again, I'm going to want to check their electrolytes. What's
Mm.
going on? They may be low in magnesium, they may be, but I would rather have them start consuming things that have magnesium in them than just popping the pill. Because honestly, I'm not even sure that until we recheck the magnesium in a couple of
Mhm.
months, I don't know if that pill's doing any good. At least if they're eating things that have magnesium in them, then I know that the body is at least having a chance to process it.
Okay.
But good question. I mean, we talk about we talk about supplements a lot.
A lot.
And it's the same thing as the coffee, right? I mean, when I was in medical school, they told all of us to take vitamin E every day. It'll prevent, all sorts of things. By the time I got to my residency, they said stop taking the vitamin E. So, it's tough to keep up on it. That's why I just think, you know what? If I'm eating the right things, the body will figure out what I need.
Yep. Okay. Thank you.
Hmm.
I have a question about the exercise. Does it have to be like you're getting your heart rate to a certain point, or is it literally like just the walking, like the dog 4 miles a couple
Yeah.
days?
So it
Or
truly is 4,000 steps. And they looked at that. They looked at, does the 4,000 steps have to be at a certain rate? And the answer is no. So just
Mhm.
getting those 4,000 steps in. Now, that is for longevity, right? So that includes your heart, your lungs, all of that. If we're starting to talk about, I just got that damn DEXA scan and now they're telling me that I'm osteopenic or I got osteoporosis or whatever. Now we're talking about a different exercise, right? We're talking about more weight bearing. So that's when they may say, that's fine, go do your walk, but put on one of those weighted jackets or take a couple of bottles of water with you to add some more stress on your bones to increase the density of it. But from a purely longevity standpoint, 4,000 steps.
wow, I
That's,
feel like good. I'm doing that.
Yeah,
yeah, me too.
yeah. Well, I mean, we'd read, and I don't know where the heck it came from, but 10,000 steps, right? So my watch yells at me
Oh,
and says, "Oh,
Oh
I
everywhere.
yeah,
only got 6,000 steps in today." But when I read this
yeah.
article, I was very happy to hear that their data, they looked at it all. Going over 5,000 steps really didn't change anything, but going below that 4,000 steps made a difference.
And not the
Interesting.
heart rate thing, because you know how sometimes they want
No.
you to get your heart rate up to a certain. No. Okay.
No.
Wow.
Now this is for longevity. If someone, let's
Yeah.
say
Yes.
that
Yes.
yeah, that somebody went through chemo
Not like
and
losing
and
weight
was
or something.
and was having problems with their heart, and they said, well, you got to get your ejection fraction up. Then they might say, we want you to get your heart rate above 100 for a certain amount or whatever. But for the rest of us, just overall health, 4,000 steps a day.
Awesome. Thank you.
Hmm.
Hmm.
Well, I thank the few of you for being persistent. I'm glad we at least got a few people
It was
on.
difficult to get on.
But I appreciate you hanging with it. So at least
Oh,
and again, it's going to be recorded, so they'll put it up on the HCF website. So at least hopefully those that missed it can get on and watch it. And again, Beth knows that if all of a sudden there's a no show sometime in the spring, I'm happy to update it, see what new literature we've got, and we can go over it. It is I will say that it is fascinating to me the change. I've been doing this for over 20 years. The change, I mean, survivorship wasn't even something that I was taught when we first came out because it was all about the drugs and the treatments and the surgeries and the radiation. And when you look at that number and you think 23 million people are going to have survived cancer, it's now, okay, so what are we going to do with the next 40 years of their life? Right? We want them to be as healthy as they possibly can. So I think that more of the focus needs to be on that than the 1 year that they were going through hell with treatments and surgeries and all that crap. So I'm
mhm.
happy to see that there's so much data. I'm happy to see that the organizations are changing the way that they're looking at it and talking about it. And I continue to try to figure out ways that we can expand that. Beth always uses the term thriver instead of survivor. And I like that, right? Because that
Love
is
it.
really what we want. And, those that come through this and make some of those changes, right? I mean, so maybe they weren't walking 4,000 steps a day. If they've now finished treatment and they eat a little bit more from the periphery of the grocery store, and they drink just on the weekends and not during the week, and they're doing the 4,000 steps a day, I can tell you they're going to live longer having been diagnosed with cancer than if they hadn't been diagnosed.
Mm.
So sometimes it is, geez, that was horrible, but now I'm in a place that I can move forward. And the same thing with the mental health. I mean, if this allows us to screen someone and get them the help that they need moving forward, then that cancer may have been a blessing in order to get all of these things to thrive for the next 40 years.
Mm.
So if anybody is interested in listening to me ramble about survivorship, I try to put out a 2 minute, no longer than 2 minutes, but I try to put out a 2 minute video on LinkedIn every week.
Hmm.
And it's specifically on diet, exercise, and mental health around cancer survivorship. So if you're really bored someday, I think there's 85 of them out there currently. But again, it is definitely become a passion of mine, and I think that there are more and more people that are realizing. In fact, just last year, they started the International Society of Exercise Oncology. First time, brand new society and they're having their very first meeting in Germany next summer. And it's because there's now so much data that shows us that being active both during treatment and after treatment is tremendous.
Eat the rainbow. That's what I read
Yeah,
somewhere. Eat the
yeah,
rainbow every day.
yep. The more colors, the better. And
Hmm.
again, if you start looking into any of this microbiome stuff, which again, I've only done a little bit of reading, but the reality is, Christina, as you're eating all these different things, you're making the microbiome happy, which is making your immune system happy, which is making your brain happy. So, it kind of, again, if you're doing the brown diet, none of those things are going to be happy.
Just have to work on sleep, but the eating part I got.
Well, and again, it is important. It really is important. And we talk about sleep hygiene, and making sure that we don't have a television in the bedroom, and we're wearing a sleep mask and doing earplugs and not drinking coffee and eating chocolate and having that third glass of wine before we try to lay down. But there are things then that need to go beyond that. I mean, this is a billion-dollar business, right? If you get on Amazon and just type in sleep aid, first you'll get all sorts of crazy vitamins that you don't want to be taking.
Mm.
And I can tell you from a medical standpoint, which 25 years I've been doing this, I've never written for a sleep aid. When people come into me and they say, I want a drug, I'm like, no, they're addictive. They're not going to help you out. I'm not going to do it. But we can talk about all this other stuff. But if you get on Amazon and you put it in, you're going to see things that make noise. You're going to see things that cancel noise. You're going to, I mean, it's just, and if you truly read any of the reviews, none of them work. But it's finding that sleep hygiene that works for you. Some people need to do meditation before they go to bed, yoga before they go to bed, read a book before they go to bed, as opposed to watching these race cars and shoot 'em ups before they go to bed. But I do think the mind vibe and tapping into the whole, Vegas aspect of it is something that can help reset that, right? I mean, we've stretched it to the max, and maybe just throwing on a sleep mask isn't going to help us. But that mind vibe really can help. I can tell you that Beth just hooked it up to me. Talk about no consent, but I was visiting her and I was working on my computer and she said, I'm going to hook this up to you. And I can tell you, after she hooked me up for that one treatment, um, I hadn't had a dream in probably 2 or 3 years. And I didn't realize it. I had no clue that I wasn't dreaming.
Yep.
she plugs this in. I get up the next day. I'm like, what did you do to me? But I literally have had a dream every single night since she hooked that thing up
Wow.
to me.
Wow.
So, but good stuff. Good stuff. It's all about trying to find what works for you, but doing the best that we can. The exercise, the eating the rainbow, the mental health. That's what's going to have us live the longest, healthiest, happiest life.
Thank you.
Perfect. And I highly recommend you don't watch the Eagles game.
No.
No. No.
It took years off my life last night. Why?
Or the
And
last 3
Yeah.
weeks?
yeah,
Yeah.
but
And then, and
Monday
you stay
night
up late for that.
No, I didn't.
overtime, what was I thinking? But enough of that. Live and
Yeah.
learn.
Tonight you'll get a better night's sleep.
I know, because I'm exhausted from that game.
Oh.
Thank you.
Thank you,
All right,
Bill.
you are more than welcome. Thank you for hanging in there and jumping on. And again, next month, Jody's going to be talking about the small groups, and I think that is just so important to be able to connect and get involved. And again, it's all about that healthier, happier mental health. So,
Yeah.
all right, well,
Thank
happy holidays to everybody.
Happy
You too,
holidays.
Hopefully
Bill. You too.
this will end up at some point on the HCF website. But again, if anybody has any questions in the meantime, don't hesitate to reach out. I'm happy to try to answer them for you.
Thank you so
Thank
much. It
you.
was great.
Happy holidays to
you.
It's
everyone.
awesome.
Happy
Thank
holidays,
you.
everybody.
Yes, happy.
Enjoy.
All righty, take
Bye
care.
bye.
All
Take
right,
good
Bye
Bye.
care.
bye.
see you
Bye-bye.
later.